Education, Jason Luan, followed by remarks from Minister of Justice and Solicitor General Doug Schweitzer. And then we'll have remarks from the co-chair and chair of the committee, Rod Connect and Jerry Bemister Williams. And then after that, we'll open up the floor to questions. And there are also questions on the phone line this morning as well. Minister Luan.
Thank you. Good morning, everybody. Thank you for being here today. And thank you to the chair and co-chair of the review committee, Chief Rod Connect and Professor Jerry Bemister, for attending today and speaking about the final report. In our election platform, we committed to listen to the voices of Albertans who raise serious concerns over the impact that supervised consumption sites are having in their communities. We kept our promises when we appointed an expert review committee who listened to more than 19,000 Albertans as they completed their review. The committee engaged in extensive consultation with Albertans in communities where the sites are currently operating or are proposed. The committee conducted a fair and thorough assessment of the social economic impact of supervised consumption services in our province. I thank each member of the review committee for their hard work and incredible dedication to consulting with Albertans on this very important issue and ensuring that their voices were heard. I also want to thank every Albertan who took the time to attend the town hall, fill up the online survey, or meet with the committee members. The report we're releasing today contains the finding of the review committee as they heard directly from over 19,000 Albertans. This is not the first time Albertans have voiced their concerns, but now their government is listening. We hear you. And I have to say, I'm deeply troubled with some of the findings of the report. We provided a forum for Albertans to express their experience, whether positive or negative, about the effects of supervised consumption sites on their homes, business, and the communities. What we heard was a wake-up call. From increases in social disorder to discarded needles to the near absence of referrals to treatment and recovery, what we see is a system of chaos. Chaos for addicts who desperately need help getting well, and the chaos for communities around the site. Now it's our government's job to carefully study the feedback provided and determining how we will address the concerns of Albertans. Speaking of concerns, we have heard disturbing allegations of financial irregularities of Arches, who is a provider of supervised consumption sites in Lethbridge. Yesterday, we sent a team of auditors into the site to collect documentation for analysis. I will have more to say about this in the coming weeks. Today, I will say that decisions about next steps for all the sites will be made on a city-by-city basis. We will take our time to make the best decisions for our communities based on the local realities, while ensuring that Albertans have access to treatment and recovery without sacrificing community safety. With regard to the report, we accept it in its entirety. Our key areas for immediate focus are align funding priorities to support a recovery-oriented continuum care, dealing with issues of needle debris, developing standard rules, policies, and quality control measures to ensure quality across all site operators. Accountability, I should say. We also want to work very closely across ministries, especially with Justice. I'm so honored our Minister of Justice and Solicitor General, Honorable Doug Schweitzer, is here with us today when we release this report. Our approach to addiction is firm, fair, fair, firm, and compassionate. Fair to the communities dealing with addiction, firm in fighting the disease of addiction, and compassionate in dealing with addiction as a healthcare issue. We're fortunate to have our chair and co-chair of the review committee today with us to answer questions of the final report. But first, I will invite Minister Schweitzer to speak briefly about his observation of the report on the law enforcement and the community safety side. Thank you, Minister.
Perfect. Thank you, Minister Luan, and a deep amount of gratitude and thanks to the hard work of the committee in preparing this report that we have here today. I just want to say thank you to you. I know how many hours it took you guys traveling the province and talking to people, so thank you so much for taking that and doing that for the province of Alberta. As many of you know, particularly in the last few weeks, Minister Luan, the Associate Minister of Mental Health and Addictions, and I have made numerous announcements across Alberta. Our offices are collaborating and working very closely together because we do believe that this is the future path for law enforcement in the province of Alberta. It is a collaborative approach, one that is, again, as Mr. Luan mentioned, fair to people, and that's why we've launched things like drug treatment courts. Just this week, we launched the first drug treatment court outside of the city of Calgary and Edmonton, in the city of Lethbridge. That's not going to be the last one, though. We're looking to expand into other regions. We want to make sure that these are available across the province of Alberta to people that are suffering from addictions, and that's very important for us. But at the same time of having that balanced approach on treatment, having those accesses and off-ramps available for people, to give them hope, to give them the opportunity to restore their lives. In addition to that, we're also providing additional resources to the Alberta Law Enforcement Response Team to go after organized crime, those that would prey on the vulnerable, those that would cause chaos in our communities. We're going to be providing additional resources to crack down on organized crime, to get particularly drugs like methamphetamine, which is causing havoc in the province of Alberta, off the streets. So that is one of the reasons why we've announced both the fact that we're providing treatment options through drug treatment courts, which is compassionate, but also going after organized crime through additional resources for our police services across this province. This study has been eye-opening for us in taking a look at what's happening in our communities and the complete disorder, particularly in the surrounding areas around these supervised consumption sites. It's unacceptable in the province of Alberta. The rule of law needs to be upheld. And too many of these areas where you have effectively a blackout zone or no-fly zone for police services is not acceptable. We need to make sure we have a consistent approach in the province of Alberta. We're going to be working with the police chiefs across our province to make sure that we have a consistent approach in this province to ensure that the rule of law is upheld. All Albertans deserve to feel safe, regardless of where they are in our province. They need to make sure that our communities are safe. We had a very disturbing situation. I wish that this would kind of be an isolated circumstance, but we had a very disturbing situation in Lethbridge yesterday where a security guard was sprayed with a needle full of blood in one of these areas around a supervised consumption site. Again, this type of behavior is completely unacceptable. And it goes to the whole area of social disorder that we're seeing in the surrounding areas. And Albertans simply deserve better. Again, I just want to thank the committee for all of their hard work on this. Just one other point that I wanted to raise as well, and this is one of the areas in the report that I found very disturbing. It's a trend. And it's an area as to why we need to make sure we get methamphetamine off of the streets and make sure we crack down on those that would victimize Albertans, is the fact that we've seen 400% increase in the use of methamphetamine, 250% increase in the trafficking of methamphetamine. This system was not designed for meth. Meth creates different behavior patterns that cause further chaos and disorder in our society, and we need to make sure that we deal with the reality that we have here today. And we need to make sure that we get meth off of our streets. That's why we're going to be organized with our police to make sure we crack down on those gangs and those other groups that are bringing this and going after the vulnerable in our society. And so I want to thank the committee for all of their hard work. I want to thank Minister Luan for working so closely with us on this and the path forward. And with that, I'd like to introduce Rod Connect, the chair of the committee.
Thank you, Minister Schweitzer. The Supervised Consumption Services Review Committee was tasked with assessing the socioeconomic impacts of supervised consumption sites on the communities surrounding them. I first want to thank the committee members for their hard work during this review. Each is an expert in his or her field and provided valuable insight and input based on their education, their knowledge, and their experience. Our Vice Chair, Professor Bemister, is an expert on therapeutic recovery in the justice, mental health, and addiction systems. Dr. Ray Baker is a specialist in occupational addictions medicine and recovery-oriented systems of care. Steve Cormack is a real estate agent and a 24-year veteran of the Royal Canadian Mounted Police. Dr. Charles Ells is a psychiatrist, addiction specialist, and occupational physician. Joan Holohan is a mother who tragically lost her son to addiction and a principal and senior consultant in Mercer's Calgary Health and Benefits business. Dr. Paul Maxim is a former professor of economics at Wilfrid Laurier University and a director of Masters of International Public Policy program at the Basile School of International Affairs in Waterloo, Ontario. And finally, Dr. Rob Tanguay is a psychiatrist and the medical lead for the Alberta Opioid Addiction Training Program with Alberta Health Services. I want to personally thank each of the committee members for their dedication, their professionalism, and commitment in bringing this report forward today. The committee worked long hours and spent many days away from home, and the members showed their deep commitment to serving all Albertans during this process. I can tell you that this was a learning experience for each of the committee members. Our mandate was to assess the social and economic impacts of supervised consumption services on their surrounding communities. I'm pleased to provide some information on how we completed this work, including province-wide engagement and additional information gathering. Our committee vice chair, Professor Bemister, will also provide a brief overview of some of the key findings in the committee's final report. Throughout the month of September 2019, our committee heard from more than 19,000 Albertans on the issue of supervised consumption services sites in their respective communities. We particularly sought to get an idea of whether residents experienced a change in their communities after the sites opened, and if so, what those changes were. Albertans were engaged through public town halls, online surveys, email submissions, and during meetings with key stakeholders. To this end, we met with stakeholders including business organizations and community groups near the sites, as well as site operators, municipal leaders, self-advocates, parent groups, clients of the sites, and first responders. These meetings gave us an opportunity to have in-depth conversations about the effects of the sites, positive and negative, from people who lived, worked, and visited the areas around the sites. This was profoundly insightful for the committee. We heard from more than 16,000 Albertans through 2 public online surveys. One of the surveys was for all Albertans, and one specifically for businesses in the areas surrounding the sites. Furthermore, we heard from over 500 individual first responders through a special online engagement survey. Approximately 1,800 Albertans took time from their busy lives to attend town halls across the province. Once the engagement period ended, the committee also requested additional information on various topics that included copies of reports from site operators to Alberta Health, information on known overdose deaths, EMS calls for service and police statistics, socio-demographic characteristics of the site locations, and finally, data relating to local businesses. With this information, we began analyzing what we'd heard and compiling our findings for the committee's final report, which we did submit to government at the end of December 2019. I will now turn it over to the Vice Chair of the Supervised Consumption Services Review Committee, Professor Bemister, to take us through some of the key findings of the final report. Jerry.
Thank you, Rod. Good afternoon, everyone. I'd like to echo Rod's thanks to our fellow committee members and our gratitude to each and every one of the more than 19,000 Albertans who participated in this review. Whether it was taking the time to attend a town hall meeting, fill out the online survey, or join us during a stakeholder session, our work depended on their participation. I can tell you a vast majority of Albertans we heard from agreed on the need to better support people struggling with addiction and provide opportunities to move beyond active addiction and towards long-term meaningful recovery. It is clear to me that Albertans care about their neighborhoods and their neighbors and their communities. Many community members spoke passionately about the changes in their communities since the opening of the supervised consumption sites. Predominantly feedback as you now know, showed these changes had a negative impact. So what we heard, we placed into 8 categories, the first of which was public safety. The second is general social disorder. And we moved into consultation and communications issues. We recognize that to have its own category, as well as the appropriateness of the current response. Concerns with referrals to treatment was also another category. Homelessness, economic impacts, and concerns with site operation. With respect to inadequate consultations, in order for the operators of these sites to operate in our province, they were required by the federal government to consult with a broad range of people in the community. During our review, we heard several times that both residents and stakeholders felt left out of this consultation process right from the outset. So several businesses and stakeholders even indicated that they had received no prior notification of the site selection whatsoever. Also, serious questions were raised concerning the level and reasonableness of the federally mandated consultation process site operators had to go through. The committee had heard over and over again about inadequacies in this consultation process. Specifically, they ranged from negligence in not consulting through to deliberate attempts to minimize consultation with the public. The panel became very concerned with this issue, and it's because of its a key process in the development of these sites. It became quite concerning for us. Moving on to record keeping and reporting, the accuracy and the consistency of the data collection, reporting, and recording of data also varied on many levels in our findings. One specific example I can give you is the definitions used to describe adverse events and overdose reversals. They varied from site to site in the reporting that we were given. In many cases, adverse events, even if non-life-threatening or minor, are reported as overdoses. And the term reversal is used when the response was a simple administration of oxygen. This leaves the public with an inference that without these sites, thousands of people could fatally overdose or no longer be alive. Comparatively, rare cases resulted in the use of naloxone or calls to EMS. As a result, again, the committee became concerned with the issues of transparency and accountability with respect to the way overdose reversals are tracked and reported. The committee found this to be misleading, and the ambiguity and faulty reporting cannot responsibly make such a determination. Now, this next slide behind me with the key findings with respect to death rates. Although there have been no fatalities at any of the sites, opioid-related deaths increased within the immediate vicinity of the sites after they opened. Next, we're moving on to death rates. So this slide behind me is based on the medical examiner's data on drug and alcohol poisoning deaths, most of which were opioid-related. The committee was profoundly struck by the findings of the increases in deaths proximal to the site as well. In some cases, and I think the Minister mentioned this, areas experienced between 100 to 400% increase in fatalities around the site. As highlighted in the media as of late, another issue that we found as a committee was that methamphetamine use accounts for up to 50% of the drugs consumed at the sites, something these sites were not originally designed for. This was surprising and seemed antithetical to the purpose of the sites, which is to address the opioid crisis. Meth users are generally less at risk of dying from an overdose. As was mentioned in part, the side effects of methamphetamine are characterized by agitation, aggressiveness, paranoia, psychosis, and other bizarre behavior that increases and adds to the already social disorder. So again, we as a committee were concerned as the sites were not equipped or designed to handle methamphetamine users. So now I'd like to move on to crime and some key findings around the crime reporting. So crime is measured by police calls for service, also generally increased following the opening of the sites. As an example, the number of reported incidents of crime in the vicinity where the SCS in Lethbridge is located increased substantially the year that the site was opened. The only exception that we found was in Edmonton, where there is evidence of depolicing. However, local area residents complained about a lack of response to calls for service near the Edmonton sites. Province-wide, we heard also many people complained of reporting fatigue and lack of response to police calls. In many, many cases, we had people come to the microphone or report to us that they were taking measures to be proactive on their own. So that would be things such as implementing special lighting systems, erecting fences, and other measures to keep themselves safe. We also learned from community members as well as site users and operators that the federal legislation, although not intended or legally the case, created a no-go zone for police near the sites. And lastly, with respect to public safety and needle debris, among the committee's key findings, in every community, residents reported an increase in needle debris on public and private property in the neighborhoods surrounding the sites, and the perception of decreasing safety and increasing crime by all the community members that we heard from. Also, there were reports from several individuals about feces and garbage. That was huge on the public's list. There wasn't a day when we were doing our tour that we didn't hear the word feces and garbage and debris. It was really at the forefront of a lot of the community members. We heard from many of the business owners and residents about seeing discarded needles outside their front doors, in their backyards, and even in the children's playgrounds. Despite efforts to address needle debris, including additional funding to supervised consumption site operators for additional needle debris cleanup, many community members still felt that this was woefully inadequate. Of note, several schools near the sites have implemented needle pickup committees before the children arrive for school, as children have been pricked by dirty needles in their communities. So what this looked like is teachers and parents taking time prior to children coming to school, prior to children going to playgrounds and parks, and sweeping for needles. We heard from families that they were avoiding public parks altogether. So as previously mentioned, needle debris, needle distribution has been a large concern in this province due to the lack of accountability the site operators have for tracking what they distribute. So for example, some site employees disclosed to us they gave out party packs. This, in most cases, is a brown paper bag with supplies that includes clean needles, clean crack or methamphetamine pipes, and other supplies for safe ingestion that can be removed from the sites. This is only a short summary of what we heard through the process. I want to say that these concerns and frustrations expressed to us by the residents, businesses, community members, parents, first responders, and those on all sides of this issue are valid. Nonetheless, Albertans feel compassion for people struggling with addiction. But many Albertans told us the province's current approach to meet the needs is coming at the expense of the safety of the children, their homes, their businesses, and their communities. And as I said, our review found the current approach has not addressed major concerns about crime, social disorder, needle debris, and drug paraphernalia. Our committee has submitted considerations for improving the social and economic issues we have identified, but the final decisions lie with government. The Supervised Consumption Services Review Committee recommends the government to consider the accounts of Albertans who took the time to share their views with the committee and incorporate solutions into a balanced approach to addiction care in this province. Thank you all for your time today.
Thank you, everyone. We'll now go to questions and answers. We'll start in the room, and I would ask you to limit to one question and one follow-up. And also, if you could state your name